Hello everyone, and welcome back to my channel. My name is Dr. Stephen Roth, and I'm a board-certified oral and maxillofacial pathologist. There are many unsung heroes in pathology, from the administrative staff that makes sure pathology reports are accurate and get out on time, to the histotech that cuts and prepares the slides. But one of the most crucial unsung heroes is a pathologist assistant. PAs, which in this context refers to pathologist assistant, not physician assistant, which is a different but also important member of the healthcare team, are a vital part of any pathology service. Among many other responsibilities, PAs perform gross examination of specimen, which is examining and sectioning a specimen before it gets placed on a slide and viewed by a pathologist. If you want to see me gross examine a small cancer, I've linked to a video both on screen and in the description below. In my previous position, I spent lots of time in the grossing room with my surgical specimen, and doing so, I got to know the incredible PAs that tirelessly work to ensure optimal patient care and diagnosis, often without the recognition of their vital role. I wanted to shine a spotlight on this crucial role and raise awareness as to what PAs do and to recognize their importance. I asked a former colleague and friend, Marissa Spencer, if she'd be willing to discuss her role with all of us, and she kindly agreed. But before we get into it, just a quick disclaimer that all opinions expressed in the video are ours and our alone and do not represent any organization that may employ us or that we may belong to, and that this video is for educational purposes only. Should you have any questions or concerns about your oral or systemic health, please see your nearest oral or systemic healthcare provider. Marissa Spencer, PAASCP, is a board-certified pathologist assistant, or PA, with a passion for pathology and patient advocacy. Marissa has experience in surgical and autopsy pathology and leadership and management experience. At her current institution, she is a lead PA and has prior experience as a supervisor of both autopsy and surgical pathology departments. Marissa is passionate about education, training both pathology residents and PA students. She previously was a faculty member at a PA program and currently serves on the board of trustees for the AAPA, or the American Association of Pathologists Assistants. Prior to that role, Marissa served as external marketing subcommittee for the AAPA, through which she's able to travel to various conferences, write articles, and educate others about the pathologist assistant's profession. Without further ado, here's my discussion with Marissa. Hi, good morning.
Hi, good morning. How are you?
Good. It's good to see you. It's
Good to
good to
see you
see
as
you.
well.
So as we were talking about with Zoom, we're limited with time to 40 minutes. We're bounded. So we'll just jump right in. I know that PA's pathology assistants, a lot of people, especially myself included, I didn't even know that they existed prior to pathology. So I'm sure there's a lot of people watching this that have never heard of a pathology assistant or PA, or when they hear PA, maybe they think of physician assistant. So I was hoping you could just start with a crash course in what is a PA, what do PAs do, and what does kind of a day look like for a PA, a pathology assistant.
Yeah, so you're totally right. We're a really, really, really small field of work. So people, even within pathology, often don't know what pathologist assistants actually are. So PAs are certified advanced practitioners within anatomic pathology. So it is very similar to physician assistants or physician associates, as well as nurse practitioners, but we're highly specialized to work in the field of anatomic pathology. We're both academically and practically trained within mostly surgical pathology and autopsy pathology. It's a 2-year program, just like it would be for a physician assistant or physician associate, where your first year is mostly didactic work. You're doing a lot of, your book learning, and then your second year is your clinical work. Each program is a little bit different, but they're all through NACLS. NACLS is who accredits laboratory professional programs. So your clinical rotations, a lot of schools have like a match system, kind of similar to a residency, where you end up matching with a hospital system. You go to the hospital system for anywhere from 10 months to 12 months and learn things at the gross bench and beyond. So there's a ton of different things that PAs do, but they're all within anatomic pathology. Um,
Quick question. So with
yeah.
the match process, is there an interview involved, like with like a residency interview where you get ranked by the institution, or
is it pretty much just like a paper application only and then get ranked by the institution and by the student?
Great question. It depends on the program. So most programs don't necessarily do like a true interview process for that. What they do, I can only speak for the programs that I've worked for and the ones that the one that I attended as a student. But basically, they kind of present all of the different opportunities because in order to have a match site or rotation site, there's an affiliation between that hospital system and the
Mm.
program. So some programs, like for example, Duke's program, majority of their rotation sites are within the Duke system, so they're local to Duke. Versus Rosalind Franklin, which is in Chicago, they have rotation sites nationwide. So when they'll give a presentation about all the different locations you could rotate at and what's available at those sites, because every hospital is different and the roles of a PA would be different at those institutions. The student then ranks their top 3 locations that they'd like to go to, and the program faculty ranks where they feel the students would be the best fit. That being said, information about the students does go to the sites, and the sites do, agree like, yes, this seems like this would be a good fit for our entity. And that's kind of how that process works. But every program is different. So some programs, they don't even have a true match system. If they're smaller, they have every student rotate at all of the entities that they have available. So it just depends on the program.
Yeah. So sorry to derail back to
No.
what a PA does. I think but if you want to share more about what a day-to-day looks like for a pathology assistant, it's an important role that kind of gets everything ready for anatomic pathology, which is looking at things under the microscope. We have clinical pathology, which is mostly blood banks and looking at cultures and blood tests, and then anatomic pathology, which is the microscope stuff. So maybe talk a little bit more about where the PA's role fits into that microscope work.
Definitely. Yeah. So you were kind of summarizing in pathology, anything that comes out of the body essentially is going to go into pathology in some way. So clinical pathology, like you said, they're going to get fluids, urine, blood, etc. Anatomic pathology is going to get tissue. So in surgical pathology, when you undergo a surgical procedure, whether it's like a colonoscopy or, a resection for a tumor or a biopsy of some sort, that tissue comes through surgical pathology. And the role of the PA predominantly would be actually handling the macroscopic assessment of that tissue. So what it looks like to the naked eye. This is really important because some things like a small biopsy, that's going to be submitted entirely for microscopic assessment. So the pathologist, they're not going to see the tissue, but they will see it under the microscope. They're not physically seeing the macroscopic component of it, just the microscopic component and the report that's created by the pathologist's assistant when they're dictating what they see. They'll write a report. But for bigger specimens, the entire specimen isn't going to be made into a microscope slide. That is not an efficient way to get diagnostic results for our patients. So essentially, if you were to undergo a surgical procedure, the PA receives the tissue and they section through it, which is called grossing, and they select tissue samples that are appropriate for diagnoses of the pathology that's present, as well as surgical assessment. So confirming that the entire tumor was actually removed from the patient, for example, and then staging of that lesion if it is a malignancy. So when you hear something like, oh, that patient has stage 4 ovarian cancer, that's what's done in pathology, and it's done by the sampling that we do. So it's really important you understand what's normal tissue versus abnormal tissue, and then also what's relevant for staging of that tissue type. Because if you don't sample it, it won't make it to the microscope, and the pathologist could potentially either understage or overstage a case. So we're kind of the eyes of the pathologist in that sense. We're handling the tissue, and then what they're getting is the report that we're transcribing or dictating of what we see and the samples we submit made into a microscope slide. So something that's really important to note about a PA versus a pathologist within anatomic pathology is that we're key partners. We work hand in hand, but PAs cannot make a definitive diagnosis. We cannot sign out a case. That is the responsibility of the pathologist. So the work that we're doing allows them to accurately do that.
Perfect. Yeah. And if anyone watching this is a little confused about what a report looks like, I'll link in the description a video I made about head and neck reporting. So for Oral Cancer Awareness Month, I made a video about how we stage head and neck cancers, and that might be helpful if anyone's a little bit confused. But it really is important that pathology assistants, if you can imagine, sometimes the tissue that you get is as big as a watermelon. And everything we look at under the microscope has to fit on a microscope slide. So if you think about putting that watermelon on a microscope slide, you're going to have probably 1,000 microscope slides, which means number one, that you're going to spend 3 days looking at one case. Number two, you might miss something. So if you have 1,000 slides to sort through and you're going through them, you might accidentally not see something that's really important. So that's why the pathology assistant being the front lines, like you kind of discussed, the eyes of the pathologist is so, so, so important. But back to this kind of concept that pathology assistant super, super rare. I guess how did you end up in this field? Like, how did you discover it? What was your journey to become a pathology assistant?
Yeah, so when I was in high school and my freshman year of college, my dream profession was to be a medical examiner. I really wanted to get involved in autopsy. And then I realized in order to be a medical examiner, you had to go to medical school and become a pathologist. And I said, I'm not really sure if I want to do that component. And I also was kind of naive when I thought of an autopsy. I thought of the physical aspects of an autopsy. I thought about the external examination, the evisceration, which is the removal of the organs, and the dissection of those organs, not the actual microscopic assessment. And I quickly realized that the thing I was passionate about was having that hands-on experience, not the microscope component necessarily. Um, so I thought, okay, maybe being a medical examiner is not what I want to do. And I ended up taking a forensic pathology course in undergrad, and it happened to be taught by a PA. So, and he was a pathologist assistant. And I was like, who are you? What are you doing? How do I do this? So I started interning and shadowing with him in autopsy exclusively, and then I moved into surgical pathology, and started applying to programs at that point in time. I will say, um, because the profession is so small, there's only about 4,000 PAs that are certified in the United States, Canada, and the whole world.
Oh,
So it's a
wow.
really, really, really small profession. The programs, they are rather competitive and they're very small. There are about 17 programs that exist, and more are coming to light every year, which is really exciting. But the class sizes only range from 4 people to 32 people,
Wow.
roughly. So very, very small field. It is competitive, but what I would say is the most important thing you can do if you want to go to PA school and become a PA in pathology is get experience and exposure, because we are a very unique part of medicine that's highly misunderstood, mostly because we aren't patient facing. You're not seeing your pathologist assistant, right? Just like you're not seeing your pathologist. So it's very difficult for a patient or a day-to-day person to really know what this field of work actually is. Um, and programs don't want to take candidates who are maybe misinformed, or this isn't their true passion. This isn't the career choice that they want. So having exposure and some sort of experience is really, really, really important, because it shows that you really understand the general concept of what this field is, and that it's what you want. You're signing up for something you actually want to do for the rest of your life. So yeah, getting experience is really important. And then every program's a little bit different, but similar to other master's level programs, you'll have prerequisite classes you would have to take in order to qualify, letters of recommendation, those hours of experience. And then some programs require either like a, gosh, MCAT, or oh my goodness, I'm blanking.
Like a GMAT, GRE,
GRE, yes. So
GRE.
not all of them require that, but it is something that they recommend doing. Um, again, it's really up to you. Each program's a little bit different. There aren't very many of them, and they are on the competitive side just because it's such a small field. But if this is your passion, I say it's really, you should go for it. Get as much experience as you can, and there's lots of different ways to get that experience too without actually, becoming before you become a PA.
Yeah, that's exactly the same advice I give someone that how do I become an oral pathologist? I said, go find an oral pathologist and shadow them. But how
Yes.
would you recommend setting that up? Maybe someone watching this video is interested and they don't know what the first step would be or how to even approach setting up an opportunity to kind of shadow or assist as in the PA in the gross room.
That's a fantastic question. So my biggest tip I would say is actually reach out to your healthcare system. Call and say, can I get transferred to the pathology department? And then ask, say, my name is so and so, and I'm interested in this field of work. I would love the opportunity to shadow you. Do you have those opportunities available? Not every place does, but a lot of places do. I will say actually, and I can provide the link to you if you want it. A colleague of mine, he started something on LinkedIn specifically designed to help people who are interested in becoming PAs and applying to PA school find shadowing opportunities. So he's connecting people all over the country. They're applying on LinkedIn to him saying, I'm looking for shadowing opportunities and experience in order to apply to PA school. I'm located in this state. And then he's connecting them with PAs within that state who can take volunteers and shadowers. Because unfortunately, not every place allows that to happen
Yeah.
because of HIPAA, which can be frustrating for both the potential applicant and honestly for someone like me who loves to share and teach and do. So that's something that is a good opportunity if you can reach out on that LinkedIn site. But otherwise, really, you kind of have to work for it. If it's something that you want, you have to really look for those opportunities because they are few and far between. But reaching out to healthcare systems is a good thing. You can even ask the schools if you are, willing to reach out to them and say, I'm really interested in shadowing. I'm having a hard time finding an opportunity. Do you know someone that you could reference to me to reach out to about shadowing? And they might be able to help you as well.
Perfect. Yeah, and I'll put the LinkedIn in the description of the video so that way people can get set up. But that's great advice. Just switching gears a little bit because one of my, I guess I'm interested in kind of the weird and unusual. That's the cases that always stick out in my mind of things that I've seen both clinically in the clinic and grossly and under the microscope are what I find most interesting. So I don't know, do you have like a case or two that sticks out in your mind as something that is strange or something that was interesting or something that you saw either during a grossing experience or something that kind of sticks out in your memory?
Definitely. And so I have a lot, and I would say strange and interesting is a very subjective term because everyone has a different idea of what strange or interesting might be. So I'll give one that I think is really meaningful and kind of solidified why I'm doing what I'm doing and why it matters. And I'll give an interesting one as well. So my interesting, meaningful one I'll never forget. I was working in a high volume academic institution where we actually worked in the operating room and we
Oh,
would
wow.
go directly into the OR and consult with the surgeons. So any complex specimen, we would pick it up from them directly and discuss before doing a intraoperative consultation or just handling the tissue. In this case, it was a really young woman. She was in her early 30s. She was pregnant. She just had given birth a few weeks before, and she was undergoing a bilateral mastectomy for multifocal breast cancer. Um, she had 13 biopsy sites, so they had biopsied her breast at 13 different locations within the bilateral breasts and had multiple areas of cancer. And in her clinical experience and journey before surgery, they were trying to decide, what can we do to treat this while she's pregnant before surgery? What are we going to do to help this woman? And I remember thinking, oh my goodness, this poor woman, what she's going through, I can't even imagine. And she did undergo chemotherapy and radiation therapy of some sort prior to the surgery, even with the pregnancy. So that made my job as a PA actually very challenging because she had good response to that treatment. And when patients have good response to treatment, what happens is their tumor starts to shrink, right? So now I'm trying to find the areas of concern so that we can assess histologically under the microscope how well that treatment actually worked. And I'm struggling to find definitive areas. Everything looks kind of homogeneous and it really was hard. And this case took me hours and hours and hours. I had to stay overtime that night to work on this case.
And not to
Um,
interrupt, but
Yeah.
just so that people understand kind of what you're looking at, this could be a matter of 5 cells that have
Yeah.
survived chemotherapy and radiation. Now imagine trying to look at or find an area of 5 cells
Yes.
with your naked. So it's what you're highlighting here is so critical and so difficult. Sorry to interrupt, but I just want people to
No.
realize the gravity of what you're saying, that trying to find that area that was cancer before after getting treatment. And fortunately for the patient, treatment worked. But
Yeah.
as we still have to assess what that looks like under the microscope. We have to prove how well that treatment worked. And
Exactly.
that's why it's important to do the sampling. So sorry, continue your story. I just want
Yeah.
them to understand the gravity of what you're saying.
Absolutely. And even adding to that, we have to prove that what we saw in imaging is consistent with the tissue, because tissue is the gold standard. So I think it's um, commonly misunderstood. Pathology is the one that actually does the diagnostic work. So when clinicians are looking at things on imaging, they are using their knowledge to make basically a guess almost. It's an educated guess, but the tissue is the gold standard. That's how we know definitively what's going on in your body. So on imaging, this looked like multifocal disease. Now I have to prove that the treatment was successful. And I also have to prove that that initial thought that it was multifocal, meaning more than one lesion, is accurate. And that it wasn't just one big tumor, because that changes the staging of the case and the prognosis for the patient. So making sure that what they're seeing on imaging is accurate to what actually is happening in the body is really, really important for the outcome of this patient. So this case, basically, it took me such a long time, and this was years and years ago, but I think about it all the time. Whenever I'm having a hard case, it's taking me a very long time and the work is very tedious and I'm feeling like I need a mental break, I think about the impact it's going to have on the patient. Because if I missed something or I didn't sample something appropriately, once it's done, there's no going back. It's really hard to kind of fix an error. Once you cut something, it's been cut. So I always think about, how is this going to impact the patient? What is this going to do to affect prognosis or diagnosis or stage assessment? How is this relevant to them? And that one case really sticks out in my mind as something that was really meaningful and interesting to me, because sometimes I think because we aren't patient facing, it's really easy to remove yourself from that component and not think about the patient. Um, there's a lot less of an intense, gravity of significance sometimes when you're not thinking about that patient. But when you put them right at the center, it's like, oh, this really matters. This really means a lot. And as far as strangest cases goes, I have had so many cases that I'm like, I cannot believe this is going on right now. One that really sticks out to me at my first job, this patient, he actually happened to be a clinician that worked at the
Oh,
hospital. So
wow.
this was a little bit intimidating for me, thinking, gosh, this is an important person, VIP patient. Um, he kept getting sinus infections and they didn't know what was going on. And it turned out he actually had a tumor growing in his sinus cavity, taking over his nose and going into his cheek. And they basically said the only way to go about taking this out is to take a quarter of this gentleman's face out. So when I got the specimen, I received this entire component of the face. So it had the eyeball as well as the entire nasal cavity, skin, all the way, and the very deep margin, so the very posterior aspect where it was resected, also had brain parenchyma. So this lesion was very extensive, very aggressive, and that brain margin was positive, unfortunately. And I remember thinking, this is a really interesting specimen, because because of the tumor type it was, even though this was so aggressive, the sizing, or I'm sorry, the staging is based on the size. It still ended up only being a PT1, which is like the lowest stage. Yeah. Which is crazy because this person lost a quarter of their face. But the prognostic factors were not very good, because this was a high grade lesion. It was really aggressive. It was invading into different structures. And that those margins were very close or positive, which is a poor prognosis for this patient. So that was really interesting. And also keep in mind, this person is still alive. Pathology, in surgical pathology, the goal is to keep this patient alive and well. We're trying to make them tumor free or pathology free, and assess that the surgery went appropriately. So holding the specimen in this person in my hands, I was like, I can't believe this gentleman is alive and he's going to walk around with this huge portion of his face missing. So that was really kind of interesting and cool.
Yeah. Yeah. Any follow-up on that case?
Um, so I remember, unfortunately, he wasn't doing so well about a year after that. He had to undergo more surgical procedures and treatment. And to my knowledge, I unfortunately don't know what happened after
Yeah.
that.
Yeah.
This was probably 10 years ago when that happened, but it still sticks out in my head as a
Yeah. Yeah.
specimen. And I have pictures of it, and I often, when I'm talking to students about what it is to be a PA and what we actually are doing and what kind of specimens can come across your bench, I do show that picture sometimes if I feel it's appropriate to do so, because that can be a little jarring to some people to see a quarter of your face.
Yeah.
Uh, but yeah, I think about that case quite a bit.
Yeah, those having done nothing that crazy, but a few of the Nathic specimen myself,
Oh yeah.
they're tough.
Oh yeah,
They're
the
tough.
oral composites, I mean, are crazy. I used to love to go into the OR at one of my previous places of work, and there would be two surgeons, one working on the actual, like, head and neck area, and one working on the leg. And I remember the first time I saw that, I was like, what's going on here? And it's because they're doing facial reconstruction. So it's amazing that they can use, the non-weight bearing bone and the muscles. I know you obviously are well versed in this. And then and reconstruct a jaw, and this person, you wouldn't even know necessarily that they underwent this very traumatic procedure. Their face looks incredible. It's so amazing to see that. And I think as a PA, that really was just cool for me to see, because you think about these things, and I often will look at something and say, wow, this is a really large resection, complicated resection, this poor patient, for them to go through this, what are they going to look like after this? What is their quality of life after this? Because the reality is, we do care about our face, not even in a vain way, I guess, but it's you. You want to feel like you after you've gone through something so traumatic. So it's really remarkable, the surgeries that they can perform now to transform the face so it almost looks like it never even happened.
Yeah.
It's really cool.
And it's interesting you mentioned both in this story and before experiences where you went to the operating room and worked collaboratively with the surgeon. And having done that myself as well during frozen sections where the patient is being operated on at that time
Mhm.
and the surgeon is working with the PA or the pathologist to make sure that a proper understanding of what's going on in the moment, it can be a little bit high pressure.
Mhm.
Uh, in your experience working with surgeons, with other PAs, with pathologists, with techs, what is your advice to any clinician in how to best work with a pathology assistant?
So I think this is a sensitive topic, because a lot of the time, when you're working on a patient, especially as a surgeon, you're so focused on making sure that surgery goes well, and this is your patient and you care about them, that when we have these interactions during an intraoperative consultation, it can be very, very tense, right? We have a time constraint. We want to get these results in 20 minutes or less. And the surgeon obviously wants to have clear margins, meaning that the whole tumor was taken out, and have their specimen assessed. My greatest advice to a clinician would be to trust the PA. And I'm going to give a story, and this is going to sound like a very extreme story, but it is a true story. Um, at one of the places I worked, like I said, we'd go into the operating room. We were responsible for the frozen sections. And this surgeon, he was a head and neck surgeon. He was notoriously known for coming in and wanting to section the specimen himself. Now, surgery and pathology, yes, we're both sectioning tissue, but it's very different. And when we're surgically, resecting something, they want to get it out and keep the patient, as healthy as they can. In pathology, we're sectioning so that we can assess the surgery as well as the extent of the lesion. So we are making very different cuts than in the surgery. Um, but because the surgeon had just taken that specimen out, he would want to cut in the specimen himself. And one time, he came in, it was a very large composite resection, and he wanted to section the specimen, and I stopped him. And I bravely said, I understand this is a stressful moment, and you want your margins, you want to see them right now and make sure that they're clear. I want that too, because we are on the same team. This is my patient and your patient. We both want the same outcome from this patient. We want to be able to assess the tumor. We want to be able to make sure the margins are clear. And in order to do that, I need you to let me do my job to the best of my ability. And the room was silent. Like you could hear a pin drop when I said this. No one had ever spoken to this man like this. And he stepped back and I didn't know what was going to happen, but he let me do my thing. And I'm so grateful because on the case before this, he had chopped it to bits and I couldn't get good relationships to show the greatest extent of the tumor and most accurate resection of the margins. This time now I could. And I think he realized in that moment, oh, we are all on the same team. We want the patient to be healthy. We want them to be tumor free. We want them to have an accurate assessment so they can get treatment correctly after the surgery, and sometimes just reminding yourself that everybody is here in hopes of giving high quality care. You have to let them do that is important. Trust your PAs. We are highly trained to work with tissue. We know what we're looking for. We know what's normal versus abnormal, and we know how to sample it best so that it can be appreciated under the scope. So just trust in the process of that, which can be hard to do, but that's the biggest thing I would say. And having good communication is huge. Talk to your team. If you have a resection, you're doing surgery and you take something out and it looks kind of wonky or you think it's going to be challenging for a margin to be appreciated, don't hesitate to call us and let us know that. But don't cut into it on your own because often surgeons, they want to see something, they're curious, and I totally respect that. But we will gladly cut it open and then bring it back to you to show you. Because sometimes those cuts that you're making can compromise a section we need to take. So, once it's out, that's not the final stage of care for that patient. We still have to do what we need to do on our end. So those are the things I would say to clinicians would help kind of bridge some gaps and make stronger relationships with PAs.
Yeah, and to kind of go back to what we were saying before, there's a very specific set of things that each tumor requires. And looking at that video about a synoptic summary, which is a report on a cancer specimen, each body site requires something very different.
Hmm.
So you have to be very strategic, like we were saying with the watermelon example. Rather than having 2,000 slides of a watermelon, you want to get strategic slides that tell you the whole story. And that's why it's so important. And the other thing, too, that you mentioned, as a highly trained professional, my understanding is that PAs also are licensed, correct? And there's
Yeah,
a
so
licensing exam and continuing education and things like that.
Yeah, so we're board certified. So after you complete a NACLS accredited program, which is the master's program I was referring to earlier, you become certified. You take a board certification exam, and then not all states are licensed, but this is something that we're currently working on, is getting every state to have licensure. So yes, I am licensed in New York State to practice as a pathologist assistant. So we really are highly academically and practically trained. We are certified, we are licensed. And this is our area of expertise. So yes.
That's what you do day in,
Yeah.
day out. Having been in that
Yeah.
grossing room, coming in every, for 2 or 3 hours at a time, you're there for a shift and you're
Yeah.
working through a specimen, probably better than I am. But
Yeah,
we're
and
we're
our job
getting
really, oh, sorry, I was going to say that
no, we're saying good.
our job is to not only do that job, but also train others in it. So another thing that people don't realize is that when pathology residents come through to do the residency after they graduate medical school, we are the ones responsible for their training within the gross room and in the autopsy setting. So we're showing them this is what normal tissue looks like, this is what abnormal tissue looks like, this is what you need to section through, and this is why. So that kind of gross to scope correlation that's taking place is happening through the eyes of the PA training the residents. Because most pathologists, unless they work in a very small place, if they work at a larger entity that has a PA, they aren't grossing. But if you don't know how you got the section, it's very difficult to interpret that section sometimes. So learning the gross prosection in those steps is really important. And a big part of our job as PAs is training them to do that.
Yeah, and not only that, but from the pathologist side too, you know, you're you're doing the best you can with your eyes, but
Yeah.
sometimes a pathologist will see something under the microscope and they'll need another cut. So
Hmm.
being able to explain to the pathology assistant, hey, this is what I need additionally from this. Can you get it? And be able to communicate that effectively will streamline the care and make sure that you get the information you need and that the pathology assistant is able to get you that information that you need to.
Definitely. And I would say when you're telling them you need to go back to a case, tell them why. Because a lot of times it could just be, hey, I see dysplasia here, which means under this microscope, not grossly, but under the microscope, they see these cells that look suspicious that are going towards an area of concern. I would never be able to see that grossly. So if you're saying, hey, I need more of this, I might be thinking, goodness, did I screw something up? But I didn't. It's just that you found something incidentally. So
Yeah.
telling that to your PA, having that communication is huge because it builds trust both ways. It shows like, hey, nope, this looks great, but I need more of this for this reason. Or hey, you know what? You did miss something. Like what was happening here? So that we all can make sure we're giving the best care possible. That's a really important part, I think, of relationships between PAs and pathologists or clinicians in any setting.
Yeah, very good. And you did mention kind of briefly autopsy, and that was initially what drew you into PA and to being a PA and mentioning that that's part of training for residents. Are PAs involved in autopsies, or can they be involved in autopsies?
Absolutely. Depending on where you work and what the requirements are, you can do a variety of things. That includes the external examination, so what's happening on the outside, the evisceration of the organs, meaning removing them from the body, the examination and dissection of those organs, selection of tissue of those organs, because again, we're not going to put a whole liver under the microscope. We're going to put one section of that liver, probably. Um, Creating a PAD, which is the initial report of the findings, even slide preview. What do you see under the scope? Preparation of the final summary or clinical pathologic correlation. All of the things within an autopsy can be done with the exception of the final diagnoses. That has to be done by the pathologist. So very similar to surgical pathology, where from start to almost finish, we can do every step, but that final step needs to be done by a pathologist.
Yeah, and that's so important, and what you do is so very helpful.
Well, thank you.
As we kind of wrap up, I didn't know, do you have any parting thoughts, parting words about the career, the profession that you want to leave our viewers with as the final thought?
I would say if this is something that you're really interested in and this was an engaging conversation for you when you want to learn more about it, check out the AAPA website. The AAPA is the organization that oversees pathologists assistants. It's pathassist.org. They have tons of information on the scope of practice of a PA, the different programs that you can attend, their requirements, all the links to those programs, and also classes if you're interested in kind of seeing what CE courses look like. You can register for them or look at that up. I would recommend looking into that website if you're interested.
Perfect. And I'll link that in the description. So we'll have the pathologists.org, we'll have the LinkedIn group, and then we'll have a few videos from me. One is a video where I grossed a small cancer, now nothing crazy, to kind of understand what the thought process is, as well as a reporting video, just to give a little insight, a very small sliver into what a PA does, which is quite a lot. But Marissa, thank you so very much for taking the time out to discuss pathology assistant. Very, very important for people to know about. They're kind of the unsung heroes of pathology. I don't think that they get enough recognition and credit. So I want people to know that PAs exist, and they're so critical and important. So thank you for representing them, at least to the viewers of this video. Appreciate
It's
it.
my pleasure. I'm so glad I could do that. And if at any point you want to dive into a topic even more thoroughly, I'd be happy to come back.
Perfect. All right, so everyone stay tuned, and we'll see if there's PA in the future. But thanks again, and I'll see you soon.
Thank you.
Thanks again to Marissa for taking the time to discuss her experience as a PA so that we as providers and as patients can better understand what happens behind the scenes and all the work that goes into a pathologic diagnosis. If you enjoyed this video, I do sincerely hope that you share it with someone else that will enjoy it as well, so that we can further recognize this important field. Be sure to hit the likes button and subscribe if you haven't already. Thanks again for watching, and be well.